Welcome, everyone. My name is Leka Polnyavin. I'm a professor at the School of Medicine here at Stanford. I mainly do research in cardiovascular disease and diabetes in Asian subgroups. I've been doing this research for 20 years, so I'm very excited today to have the Center for Asian Health Research and Education kick off. Yay! I know many of you have also done research in Asian health, and we are going to hear from many of our faculty members today. We were surprised when Dr. Bryant Lin and I first looked. There are over 100 faculty members at Stanford doing research in Asian health. And we wanted a place to bring all of this knowledge together to improve clinical care for Asians everywhere and to make things better for the next generation and to have Stanford, to have Asians be part of Stanford's legacy. So I'm going to talk with you first a little bit about our mission, vision, and goals. So our mission is to improve the health of Asians and Asian Americans by increasing knowledge, empowering education, and positively impacting clinical care for Asians. And we're going to talk a little bit today about the differences that we observe in Asian subgroups and how it can affect their health outcomes. So our vision is to improve the health of Asians everywhere. And that's a broad vision, but I think we can do it at Stanford. We have the necessary team, and everyone has been so wonderful in working together. We have an amazing community here in Silicon Valley, patients who are very well educated and health literate and committed to improving health for Asians. So I think we can do it. So there are just a couple of points I want to make before Dean Lloyd Minor gives his remarks. And thank you, Dr. Minor, for being here. We're honored for you to be at the kickoff. So the first point I want to make is that there's not enough data on Asians. So I'm going to show you just a few statistics. So this is a map of the Bay Area. Anyone want to guess what percent of the Bay Area is Asian? I heard some right numbers. It's about 30%. 1 in 3 are Asian. And we have a microcosm of the world here. It's all different groups of Asians. So we are in the perfect laboratory to affect health on Asians. In the world, half of the people are Asian, 51%. There's some populous countries in that circle. And yet, only 6% of the research that is done on Asians. Most of the research that we do is on non-Hispanic white population. So when I see patients, I feel like I'm flying blind for Asian patients. I don't have enough data. And there's going to be some great examples today with Dr. Gross from anesthesiology, with Dr. Kurian from genetics and breast cancer, and many, many other examples of how we need more Asians to participate in clinical research so we can be better doctors for you. So this is just one slide on research I've done looking at Asian subgroups in the US. So these are the 6 major Asian subgroups in the US, and it's somewhat arbitrary, as you can see. So it's Asian, Indian, Chinese, Filipino, Japanese, Korean, and Vietnamese. And these are the 6 subgroups that are listed on the census. So that's why we have this information on the death record. So I'm just going to tell you a little story about how arbitrary this is. And Steve Wesley and Anita, you are in the audience. So I'll tell a story about Radha, my second daughter. When she was 5 years old, we were supposed to go to the city to the Asian Art Museum. And I wasn't able to go because something at work had come up. And she was a little upset, so she's sitting in the backseat of the car. And I look in the rearview mirror, and she's upset. And I said, you know, Radha, we really go to the city a lot for a suburban family. And then she wrinkles her brow, 5-year-old brow, and she says, we're suburban? I thought we were Asian. So And 1 out of 7 babies born in California now are mixed race. So in our center, we hope to do studies, and there's very interesting studies on gestational diabetes and what the difference is depending on which parent is Asian. So these are the 6 Asian subgroups that we're able to study based on the census. And this is just a listing of the leading cause of death for men and women. Men are on the top, women are on the bottom. And you can see that there's major differences in cause of death across the Asian subgroups. So this is something that we need to watch out for when we group Asian subgroups together. Because when you put these 2 groups together, it might not look like there's a difference in heart disease, and it might not look like there's a difference in cancer. But as you can see, Asian Indian men, 1 out of 3 die of heart disease. My dad died of a heart attack when he was 39. I was 13. That's why I'm in the business that I'm in, to try to figure that out. It's been 20 years, and I realized that, I need a lot of help, so please. And we are going to hear from the Safi Clinic today, who are doing work to prevent things like early heart disease in South Asians. And you can see for Korean men, cancer is the leading cause of death. 1 out of 3 Korean men die of cancer, 1 out of 5 die of heart disease, and most of that is lung cancer. And we're going to hear today about non-smoking related lung cancer from Dr. Singh as well. So I'm just going to talk briefly about known differences in genetic response. There are many, many things that we're going to hear about also with aldehyde dehydrogenase. I hope you got to do the test that Dr. Ho was doing outside. But there are many more to elucidate, so we're at the tip of the iceberg. So I'm going to go a little bit into pharmacogenetics. This is my clinical practice now, and talk a little bit about the cytochrome P450 system in the liver. So there are differences in the CYP2C19 gene, and there's a drug that we give to people after they have heart attacks called clopidogrel. It's to keep stents open. And we give it to them for about a year after they get a stent. And this is a prodrug that needs to be metabolized into the liver, to become active and block platelet aggregation. However, there are mutations in CYP2C19 that cause increased risk of thrombosis, so it's a loss of function mutation in Japanese, Korean, and Chinese populations, and a gain of function mutation which causes increased bleeding in Asian Indian populations. And this is important because this mutation is present in less than 1% of whites and less than 1% of blacks. So you might not need to test for it if you're in a population that predominantly serves a white or black population. But that's not our population. 1 out of 3 is one of these groups. So we're in the perfect place to do these tests. So our goals are to increase research and knowledge in Asian and Asian American health, to educate patients, providers, and the community about the health needs of Asians and Asian Americans, and to improve the culturally sensitive and evidence-based delivery of healthcare to Asians and Asian Americans. And we hope to do that with all of you in this room and the many other faculty members and students and labs outside of this room that are here at Stanford. So this is our website, so I encourage you to go and look at it. And I actually want to take a moment to thank Richa Wadekar. Richa is a recent Stanford graduate, and on her way to medical school, and she has single-handedly pulled off this convening, so thank you so much, and also put together the website, so we couldn't do it without you. Thank you. So our goals for 2018 and 2019 are to provide medical education, so continuing medical education for providers as well as patients, to educate them about the differences that you're going to hear about today. So we have 20 wonderful speakers, 120 slides to just show you the tip of the iceberg about what is different and concerning about Asian health differences. We also hope to get together a spring quarter class for students, so this will be in the med school but available to undergraduates as well as graduate students. And with the help of our board and funders, many of whom are here today, thank you for supporting us, we hope to do a seed grant program. So you'll hear today about some needs, some gaps in knowledge. And we hope that with the collaboration of our community, we will be able to fill those gaps here at Stanford. There will be another annual symposium next year in October, so please put October 2nd on your calendars now. We'll have a bigger room. And summer student internship opportunities as well in the summer of 2019. So thank you again, all of you, for being here. I know how busy you are. And I am honored now to invite up the Dean of Stanford Medical School, School of Medicine, Dr. Lloyd Minor.
Well, thank you very much, Latha, and I want to thank you and congratulate you and Brian for putting together this wonderful center, and also express my appreciation to the members of the board, the advisory board, for the center. I think this center is so distinctively and wonderfully Stanford. Why do I say that? Because it brings together people from around the university representing multiple different disciplines to approach a complex and extraordinarily important issue. It's also uniquely Stanford medicine in that it leverages two really important things going on in Stanford medicine, the School of Medicine, and our two hospitals. First, it very much builds upon our vision of precision health to predict, prevent, and cure precisely. And also, it's very well integrated with our strategic planning process that we have going on in Stanford medicine. One of the things that we focused on and will continue to focus on in that planning process is how we can have even greater global impact in the future. So I congratulate all of you who worked so hard to bring together the center, and to the wonderful work that we're going to hear about a little bit later this evening, and that's going to go on for months and years to come. So as Latha was saying, Asian health is extraordinarily important to our region and to Stanford. 1 in 5 Stanford undergraduates is of Asian descent. And also our community. We're blessed in our community, our staff, our faculty, to have a very high proportion of employees, faculty, staff who are of Asian descent. So from the standpoint of beginning first at home, there couldn't be a more important topic than the topic that the center is going to be focused on. We already have a lot of exciting activities going on in Asia. Let me just mention a few. I had the privilege a couple of years ago to visit India and to see some of the wonderful programs that are going on there that have been very much started by Stanford faculty and people here at Stanford.